Hi, this is Kristen Burke. I'm going to be doing case vignette number 4. Okay. Hi, my name is Kristen. I'm one of the nurse practitioner students here. You are?
Kelly.
Kelly, nice to meet you. So, little bit about what's going to happen today. I'm going to take about 30 to 45 minutes, talk about what brings you here to the hospital today, what's going on with you, how you've been feeling lately. Some of the topics may be a little uncomfortable. I just ask that you try to speak as openly and honestly as possible. Everything we say here is confidential. The only time that would change is if I thought you were going to harm or kill yourself or somebody else, and then legally I would be required to say something. Okay? After the session is over, I'm going to give you a card. Make sure you have my office hours, number to reach the office during the day, a number to call our on-call service afterwards, and an emergency number in case of a crisis at any point in time, any day of the week, 24 hours a day. Okay? I see you filled out some of those questionnaires before I got here, and I thank you so much for doing that. They're going to help us and help you figure out, see if we can, what's going on, and some of the things that maybe we can focus on to see if we can get you feeling better. Okay? So I only really know what the physicians told me in the emergency room about what brings you here today, but I'd really like to hear it from you. What brings you here today, or why you're here in the hospital?
A neighbor of mine who's a close friend has been a little concerned, and things have been a little rocky. I divorced from my husband about 3 years ago, and we have 2 children, and right now they're with him for the summer, so it's a little quiet home. It's a little by myself time, and I'm trying to adjust, but it's been a little hard trying to adjust to all that.
Okay, good. So how, you said for the summer, how long have you said you had 2 boys, correct?
2 boys, yes.
And how long have they been gone for now?
Probably about a month.
About a month?
Yes.
Okay, so you've been gone about 4 weeks now. And how long have you and your husband been divorced for?
3 years.
For 3 years?
Yeah.
Okay. So you do they spend every summer with their father?
No, this is the first one.
This is the first time?
Summer, yes.
Okay, okay. Well, that's going to be difficult for you.
Yeah.
To have them, used to them around all the time.
Exactly.
Okay. So that would be a big change recently. Has anything else changed in your life recently?
I recently got out of a relationship I've been in for about 2 years, and just we wanted different things, and just and the greatest, so that kind of all happened around the same time.
Okay. So also
No.
something else difficult.
No.
How are you feeling every day? Like,
I'm tired. Not quite sure what to do with myself, and trying to figure out where I kind of belong right now. And
okay. When do you remember the last time you felt well? The last time you felt like Kelly?
probably before the boys left, we kind of had done some things together and gone out and had fun. And
So when do you feel like that you noticed these symptoms started happening? Or that you started to feel this sad,
Probably a couple days after the boys left and everything.
Okay, so a little over 3 weeks now.
Yeah.
Okay. And have you ever been treated for symptoms similar to this in the past? Have you ever felt like this before?
A little bit when I first divorced, but I don't feel like it's quite as much. It wasn't as much then as it is.
Okay, that it's worse now than it
Yeah.
was. Okay. Did you tell anybody, a doctor, a friend? No?
No.
Okay, that's not a problem. One of the things the doctors did mention today is that when you came in, you had some cuts on your arms. Can you explain that to me or tell me about it?
I wasn't feeling like I was the other day, and I don't really know what got into my head, but I started scratching and kind of like cutting at my arm, and then instantly realized I didn't know what I was doing and just stopped what I was doing.
Okay.
It just didn't make sense to me.
Okay. Do you think you were trying to kill yourself? Or do you
I think I was just confused, kind of trying to figure out what I wanted and seeking for something to make me feel better.
Okay, all right. Have you ever thought in the past about killing yourself?
No, I think more just missing the boys and just kind of wishing, seeing how I could make the summer go faster.
Okay. All right. The next couple of questions aren't necessarily about right now, this minute, but just in general, how are you feeling? You had mentioned you were feeling kind of sad, kind of down. Do you feel like you've been irritable at all?
Kind of, because I kind of just feel like tired and kind of like weak, almost like I'm not sleeping enough or anything like that.
Okay.
So I tend to have a shorter fuse.
Okay. Is that kind of affecting you at home and at work type thing, or is it just at work?
Mostly just at work, but not as much depending who's around.
Okay. Do you find that you've had any loss of interest in things that you like to do or things that you usually find pleasurable?
I tend to stay home a little bit more.
Okay. You feel like you're not going out as much, not
Yeah.
socializing, those
Yeah.
kinds of things? Okay. Have you ever felt the opposite of this? Like you were overjoyed or extremely excited about what was happening and what's going on?
Not really,
No? Okay. All right. Do you feel like you're ever hearing anything? Hearing voices or seeing things that aren't there?
No.
No? Okay. Do you ever feel like people are following you around? That someone may be out to get you or trying to hurt you?
No.
Okay. And, alrighty. Do you feel like you're worrying more than normal?
No.
No?
Mm-hmm.
Do you feel like when something gets in your head, maybe it stays with you and you keep worrying about it?
No, just more the motherly, what are the boys up to type thing. But
Okay. Worrying about your children.
Yeah.
Absolutely.
No.
Absolutely. Any specific situations that make you uncomfortable? Anxious, fearful?
No.
No, not really. Okay. We'd call a panic attack. I'm sure you've heard people say it before. It's a sudden onset of fear that seems to come out of nowhere. There's no explanation for it. Have you ever felt like that? Ever had those kinds of feelings? No? Okay. Do you ever feel like there's anything you have to do to avoid stress? I know it, do you? No, never felt like a compulsion, like you had to do something or needed to?
No.
Okay. Alrighty. Now, some of these questions may be a little bit difficult, so we're going to talk a little bit about, your past. Have you ever had a traumatic experience or experienced something horrible?
No.
Not really? Okay. Nothing that anytime you ever felt like your life was in danger?
No.
No? Okay. And now again, a little uncomfortable, but have you ever been physically, emotionally, or sexually abused?
No.
No? Okay. Excellent. You said earlier, we all have times when we have trouble remembering things. Where we put our car keys. Or what was I doing 5 minutes ago? Those kinds of things. But do you ever feel like you lose large portions of time? Earlier you said that, you were kind of scratching at your arms, just kind of thinking, but, you knew, did you know what you were doing? You felt like you knew what you were doing?
Yeah.
Okay. You didn't feel, any time that you feel like you've never suddenly woken up someplace and have no idea how you got there or any of those kinds of things? Okay. Do you worry about your physical health at all?
No, I just, my fibro makes me a little tired and stuff like that, but nothing.
Okay. Do you feel like you're sick than most people, or do you get sick more often?
No.
Common cold, those kinds
No.
of things? No? Okay, good. Are you eating okay? How's your appetite?
Maybe not quite as much, but...
Not quite as much? No major weight gains or
No.
weight losses lately?
No.
No? Okay. And you mentioned earlier some trouble sleeping. Can you tell me a little bit about that?
I sleep, but I kind of feel like I'm not sleeping maybe as deep sleep as I normally would. I just feel a little bit more tired than I normally would, even though I'm kind of like sleeping the same amount of time.
Okay. Do you find like you're sleeping more during the day, like taking more naps?
Not really, because of work and stuff.
Okay. Okay. And you're normally going to bed about how many hours of sleep a night you're getting?
Probably like 7.
About 7 hours,
Yeah.
right? Okay. All right. Any unusual behaviors? You don't find that you wake up and there's a half-eaten peanut butter and jelly sandwich on the
No, nothing
bed
like
table,
that. Nope.
side table, nothing like that?
No.
Okay. We'll talk about, do you drink alcohol at all?
I found myself doing that more.
Do you? Okay. So when you do drink,
Yeah.
how many drinks do you have usually?
Maybe 4 or 5 at night.
4 or 5 at night. Okay. Now are you doing, about how many times a week do you think you're doing that?
Most of the nights.
Most every
Yeah.
night. Okay. All right. Have you had any problems because of this?
I think sometimes that's why I wake up a little bit more tired because I'm sleeping is good or...
Okay. But you haven't been late for work or missing appointments, those
No.
kinds of things. Okay. All right. When you stop drinking, you feel like you have withdrawal symptoms, like you feel shaky or...
I've kind of done it most of the night, so
Okay.
I guess I went earlier.
Okay. Now, has this been going on since the boys left or since before the boys left?
Since after the boys left.
Since after the boys left. Okay. All right. Now a couple of questions about your past medical history. All right. Again, just trying to get a better idea of, all of Kelly. The whole picture.
Okay.
Any chronic medical problems that you have?
Just fibromyalgia.
Okay, you mentioned that
Yeah.
earlier. No other problems?
No.
Okay, good. Any surgeries in the past?
C-section and work on my deviated septum for my nose.
Okay. No surgery. Okay. Any seizures in the past?
No.
Any head trauma, loss of consciousness, those
No.
kinds of things? No. Do you take any medications or supplements, vitamins on a daily basis?
Multivitamins and then Aleve if I need it for fibro.
Okay. And the lead, you said?
Yeah.
Okay. Good. Any allergies to medications?
Penicillin, sulfur.
All right. Some antibiotics.
Yep.
All right. Excuse me. Sorry about that. What about your family history? Do you have any relatives who have had any nervousness, depression, schizophrenia, any of those kinds of things? Oh, okay. Any problems from substance abuse, those kinds of things?
My father is an alcoholic. So.
Okay. Your father. Any suicide attempts, psychiatric treatment, any of those kinds of things for
No.
any in your family?
No.
Nope. Okay. So again, a little bit more about Kelly, although it starts with your mother. When she was, any problems during pregnancy, delivery for you that you know about?
Not that I know of.
Nothing you know about? Okay. And what were you like as a child? Just
Normal.
normal?
Yeah.
Sick at all?
No.
No? You were able to go to daycare, school, those kinds
Yeah.
of things?
Yep.
Okay. Any learning problems growing up?
No.
No? Okay. In school, how far did you go?
Graduated college.
You graduated from college? Okay. And what do you do now?
Secretarial.
Okay. Alrighty. And how long have you been doing that job?
For about 20 years.
About 20 years.
Yeah.
Wow, okay. That same company or
Yes.
different companies? That same company. Wow, 20 years, that's a long time. Okay. Now a couple of questions about your childhood, I'm sorry. In the house you grew up in, you mentioned your father.
Yep.
Did you all grow up in the same house? Did you grow up in the same house with both your parents?
Yes, both my parents and my brother.
And your brother?
Yeah.
Just one brother?
Yep.
Younger or older?
Younger.
One younger? Okay. Was faith a part of your household growing up?
To an extent, not like every Sunday or anything,
Okay.
but still a part.
Okay. And how about now?
Same thing, not every Sunday, but still a part.
Okay. Gotcha. And ever been in trouble with the law?
No.
Ever been arrested,
No.
detained by the police, any of those kinds of
Nope.
things? Okay. On the lighter side, what do you like to do?
Spend time with the boys, go have fun, different sporting events and stuff that they have. And
Okay. You definitely sound like you enjoy your
Yeah.
family. and
Yeah.
Spending time with your kids.
Yeah.
Okay. Do you ever go online? Use the computer, those kinds of things?
Facebook or a little shopping online, stuff like
Okay.
that.
Okay. Shopping, Facebook.
Yeah.
Alrighty. What do you like about yourself?
I like stuff being able to take care of my kids, stuff like that.
Okay. You think you're a good mom. You like
Yeah.
being able to take care of your
Yeah.
children. Okay. What do you think your friends like about you?
I'm there to listen.
Okay. Alright. Excuse me again. Alright, so a good listener. Okay, I bet that helps out with your children as well as your friends. Right? And now you mentioned earlier that you were divorced and that you just broken up or ended another relatively long relationship. Okay. Anything going on right now or just...
No, just time for me right now. I'm just trying to adjust to all that.
Okay. All right. Good for you. So now I have a quick test I'd like to do.
Okay.
That way we can look at that as well as the ones that the questionnaires you completed earlier for me, okay? This one's called the mental status exam.
Okay.
All right. I just have a couple of questions and then a couple of small tasks.
Okay.
Okay. This is going to work on your ability to concentrate, recall information, those kinds of things. And your name?
Kelly?
Kelly. And what is today's date, Kelly?
April 8th.
April 8th, okay. And what time is it?
9:30.
And where are we?
In Cumberland?
In Cumberland. Alrighty. Now, I'm going to ask you to repeat 3 words for me.
Okay.
Table, dog, and pencil. Go ahead and repeat those for me.
Table, dog, pencil.
Alright, so table, dog, pencil.
Yep.
One more time.
Table, dog, pencil.
Alright, excellent. Now, spell the word world backwards for me.
DLROW.
Alright, excellent. Those 3 words we went over a couple...
Table, dog, pencil.
Table, dog, pencil. Excellent. Who is the President of the United States?
Obama.
Okay. And the Governor of the State of Rhode Island?
Gina Raimondo.
What is the capital of Rhode Island?
Providence.
In Providence. Alright. Now, I need you to repeat after me. There are no ifs, ands, or buts about it.
There are no ifs, ands, or buts about it.
Okay. Excellent. Now, do me a favor and name this item.
Cup.
A cup.
Pen.
Pen. And
Book.
a book. All right. Good job. Excellent. Now, I'm going to take this paper right here.
Okay.
And I'm going to give you this pencil. Can you do me a favor? I need you to copy that picture for me. Okay. Now below that picture, if you could just write a sentence, any sentence.
Okay.
The sky is blue. Excellent. All right. So now if you could, what does that paper say?
Hold this paper up and close your eyes.
Okay. If you could do that for me. All right. Perfect. All right. Now if you could fold that paper in half. And place it on the floor. All right, excellent. Thank you. All right. So, like I said, that was just testing some of your ability to recall, memory, and some of like your long-term memory as well as your short-term. Okay. The other questionnaires I talked about earlier that you filled out, one of them was the HUDAS 2.0. That is a real test. I know it sounds silly, but it's from the World Health Organization. Okay. It's used to evaluate any disability you may be having or difficulty you may be having in the 6 main areas of daily living. Okay. Overall, you scored as having a moderate amount of difficulty right now. Okay. And obviously that's because there are things going on. Right. Hopefully, after we spend some time together, talking about what's going on, see if we can get to the bottom of it. Over time, hopefully, these scores will improve. Okay. One of the other ones you filled out was the level 1 cross-cutting questionnaire. And what that did was give us, based on your answers, some areas to work on and look at, some things that may be bothering you, which led to the second 2 questionnaires. The first one was for depression, and on the level 2 depression questionnaire, you scored a severe. Okay. And you said that. You said that you were feeling depressed, and down and blue, especially since you're, the boys have left.
Yeah.
Okay. How old are the boys?
9 and 11.
9 and 11. Wow. sorry about that. And the second question you filled out was based on substance abuse. I know it's an odd thing that the questionnaire doesn't actually ask about alcohol. It asks about numerous other drugs. And so now again, you're not using any other illicit drugs, no over-the-counter or prescription medications, nothing like that. Okay. So the substance abuse, it sounds like it's something you're aware of, and hopefully with, some time we can figure out, maybe we can get you to cut back a little bit if that's something, you're interested in doing. Right? I'd like to thank you for talking to me today. I think that based on how you answered the questions on the questionnaires and how, what you told me today in our discussion, that you're suffering from a major depressive disorder. I would like to continue meeting 1 to 2 times a week. I think we could further investigate what's going on, why you may be feeling this way, and to see if we can get you feeling better. Okay? This here is my card that I was talking about that I said has the contact information, the office hours, and a number that you can call 24 hours a day, 7 days a week if you need to talk to anybody emergently. Okay? So now, if it's okay with you, I'd like to go to the desk and we can schedule an appointment for later this week.
Okay.
All right. Thank you.
Thank you.